You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more traditional dentures. So if you're missing one tooth or a few teeth, and especially if you have a loose-fitting denture, you have to hear what he has to say. With us, we have prosthodontist Dr. Daniel Galindo. Dr. Galindo, welcome to the program.
Thanks, Randy. Thanks for having me.
Now, for people that don't know Clear Choice, who is your typical patient, and what are the different procedures that you offer?
There's different patients that we see. We see those that have been wearing dentures for a long time. They're struggling with the denture because the denture will just not hold in place. They've lost more bone. They haven't sought care for the denture in a long period of time. Another group of people that will see us are those that will realize that they're going to lose their teeth. And they can be losing their teeth due to periodontal disease, due to decay, neglect, an accident, something that is going to put them in a situation where they're not going to have their teeth anymore, and they just don't want to go down the path of the denture.
So they don't want dentures, obviously.
They want to avoid them.
Now, what is your role? You're the prosthodontist. So what's your role in the procedure?
It's the most exciting role because I get to work with the oral surgeon and design the patient's smile. So I'll be able to work with that person that's coming with a vision of how they want to look like, and I will put it in terms of what we're going to give them. Improve the smile, give them the beautiful white teeth, what they want to share with the rest of the world. It's the first thing that they will be presenting when they're meeting somebody.
And we've talked on the phone, and one of the things you say is that in one day you transform people's lives. Elaborate on that.
Well, that's what we do. Somebody will come in with a situation where they're wearing a denture, they just can't put up with it anymore, or they're going to lose their teeth because of periodontal disease, and the day of the procedure, at the end of the day, I'm going to hang them a mirror, and they're just going to look at themselves, and it's just going to be a great new life.
So when it's done and they look in the mirror, they get emotional?
Very emotional. Even people that we would have never thought would be emotional. Just a couple of weeks ago, we treated this man that was really appeared to be a really tough guy.
Okay.
And he got the mirror. His wife was in the room, and they were both looking at his new smile, and he couldn't believe it. He started crying. Tears of joy is what we call them. But it was a happy ending to the procedure that we did for him. So going back to your original question about transforming people's lives, when these patients come back for their post-op appointments, the stories that they will share with us of how having a brand new smile has changed their outlook in life. They can go out. They don't need to think what they're going to do during the day, because it's not going to be focused on the teeth anymore. Some gentleman was telling me recently that before going out, he would really have to think if it was going to be worth going through that process of putting the adhesive into the dentures, because it was a time-consuming process, and it was also a very time-consuming process to clean the glue from the denture again. So he would rather stay at home, be seclusive, than going out and live his life not thinking about his teeth.
Okay, now there are people, now after a few visits, but on treatment day, where they can go in without teeth and leave with teeth. How soon can they eat?
They can eat the same day. We're going to ask them to have a softer diet.
Okay.
But within a few weeks, they can go back to a normal diet and enjoy the foods that they have been missing for the last many years.
Do you hear food stories from your patients a lot?
Many food stories. Of course, corn on the cob, apples, but healthy foods. Now with the health trend, people have to avoid foods that would be healthy, nuts and other type of fruits that might be just too strong for the current dental situation that they had. With periodontal disease, they have to be careful about what they bite into. With missing teeth, they have to be careful about the foods that they select. They probably stick to the soups and the softer platters when they go out for dinner.
Now, our show, The Wellness Hour, airs all over the U.S., all over Canada, and nationwide, and in Canada, if we interview medical doctors and dentists, but the dentists all know about your company. So you're very busy. I mean, you guys are looked
busy.
at as the...
We're busy. We've done here in our Phoenix Center over 1,800 procedures.
So that's what you do. I mean, your center revolves around dental implants.
That's all of what we do. Yes.
Interesting. Now, I know you brought a lot of photos.
Yes.
And these are dramatic photos, by the way.
Yeah.
There's like smile makeovers, but these are people without teeth, and now they have teeth.
Or people that have some teeth but not in good shape, and now they have much better teeth.
Okay, good. We're going to take a quick break. We come back, a little bit about the dental implant process, and then we'll take a look at some of these patients. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I've had over 12 root canals, about 15 crowns. They started falling out at the gum line. That's when I decided to go to Clear Choice. They talked to me about implants. When I learned about how the one day works, I wanted to have the procedure done the next day. I was going to wake up and have a beautiful smile.
We're able to use our technology to help them to enjoy life without a denture, just with teeth that will be permanently in their mouths.
At Clear Choice, we're bringing hope to thousands here in the Valley of the Sun who suffer from missing or failing teeth.
The team is the entire center. You have myself, the prosthodontist, Dr. Galindo, and the lab. Everybody works as a team to get these folks not just a smile, but a new function, a new lease on life.
Call today for your free consultation. We'll walk you through the entire procedure, including costs.
To have the smile that I wanted back again was amazing. I would have done it a long time ago had I known about Clear Choice.
At Clear Choice, you're about to discover what you've been missing all these years. Call Clear Choice today.
In one day, they can make you look beautiful. All the self-confidence that you didn't have before, when you walk out of here, you have it.
It improves your life in so many ways that you, like I say, you're not embarrassed anymore in public to go out and eat. You're not embarrassed to have a picture made of yourself. You're not embarrassed to talk to friends that you've seen or haven't seen in a long time. And personally, I think it took away probably 10, 15 years of my age to get my teeth.
When they hand me the mirror and I saw myself, I don't cry hardly ever, but tears come to my eyes.
I feel better about myself. I have more confidence. And one day I could not believe they really could do that, but they did.
I just wished I would have done it 25 years ago when I was younger and could take advantage of the look.
You are watching The Wellness Hour. I'm Randy Alvarez. Today's topic, dental implants, replacing missing teeth with dental implants, and especially if you're wearing a loose-fitting denture, according to Dr. Galindo, 4 dental implants?
Correct.
And you could give them a full arch of teeth. Tell me about that for a moment.
Well, it's a procedure by which you can anchor 4 dental implants in specific areas of the jawbone where we have determined that the bone availability is there, and connect a set of teeth onto those 4 implants in an incredibly predictable fashion.
And they don't come in and out with this?
They don't come in and out. The teeth are connected onto the implants, and people can smile, they can live. The teeth are constantly with them. They're just there.
So what about cleaning? Just like just like they're your own teeth?
It's like your own teeth. You're going to brush them, you're going to floss them, they're going to use a water pick, and they're going to see a hygienist 2 to 3 times a year.
Okay, so just like your regular teeth.
Yes.
Now, it seems very painful. That would be my fear.
Pain is an individual response. Here's what we know. The bone has no sensation. People respond to procedures in a different way.
So it may not be typical, but some people will say it's tolerable. And we're talking about after the procedure.
Correct, yes.
Okay.
Yes.
Because during the procedure, what? Are they sedated?
We're going to make them comfortable.
Are they sedated?
They are sedated.
Okay.
We use IV sedation to make sure that they are comfortable throughout the procedure.
Okay, good. Now, you have this team approach, by the way. And I want to mention this and correct me that the way it's normally done, you go to one person that does the surgery, and then you go somewhere else to do, put the teeth on there, and then maybe even somewhere else for the imaging. But you do everything right there. This is your kind of philosophy there?
We have everything under one roof. So the patient does not need to bounce around from one place to another. We have everything in our location. The imaging center, the dental lab, the oral surgeon, and the prosthodontist.
Okay, good, good. So let's take a look at some of these photos.
Great. Well, this is one situation of a patient that came to see us because she wasn't happy with her dental condition because it was affecting one of the passions that she had in life. She couldn't feel comfortable skydiving with the removable set of teeth that she had.
So she had false teeth and
She had false teeth. She couldn't skydive.
And she tells you this on the consult?
Yeah, she did. She told me that in the consult. And so she was looking for a solution that would give her teeth that would not come out of her mouth.
Are they skeptical, by the way? Did they ever come in and say, Doc, are you sure?
Yes. Yeah.
They do?
I mean, people are skeptical because, you know, they are used to the fact that it's going to take a long time. It's going to be a denture. It's going to sit in a jar at night. It's not going to be with them. So they do ask a lot of questions as they have educated themselves in the process of what could be done
So
for
this
them.
woman, and I interrupted you, but this woman wants to go skydiving. That was her motivation.
Yeah, she wants to go skydiving again. She says she had to stop skydiving because she didn't feel comfortable skydiving with her false teeth. So what we did is we did the procedure, and she was very excited. Of course, we gave her the mirror. Her husband was there. He was excited because he could go skydiving with her again.
Okay.
And then all of a sudden, a few weeks later, I get this photograph in my inbox, and it's her skydiving. And with the most
Is that it
beautiful
right there?
smile. Yes,
Let's
it's
take
the
a look
smile
at this.
here. Yeah.
So she sends you this.
Yes. So what we did was we gave her 4 implants in the upper jaw, 4 implants in the lower jaw, no covering her roof of her mouth, and she's back to living the life that she wants to live. Nothing is keeping her from living her life. She can go back to skydiving and just carry on with the lifestyle that she wants to enjoy.
Now, Arizona's a big place.
Yeah.
Are there a lot of people with dentures there?
There's a lot of people with dentures.
Like tens of thousands of people with an upper or lower denture, maybe?
For sure. I think we can fill the University of Phoenix Stadium with people in dentures.
If it's so good, dental implants, why aren't they all coming in to get it done?
What happens?
What's your take on that?
What happens is that when somebody reaches the stage of being in a denture, they stop going to the dentist. So they're living their life with a denture. Every now and then, they'll come in, get a reline. They're probably going to learn that they've lost more bone because the denture is loose, but they thought that they've reached a dead end, that life ends with a denture, that nothing could be done. And what we can do with the imaging technology that we have is now we can find out where the bone is available so that we can place the implants and give her a smile. Now, for her, what she did is now she can skydive. What she doesn't realize is that she can skydive with the most beautiful smile ever.
Let's take a look at this. That's very nice. I mean, they look real. I always feel like I could spot a denture walking down the street.
I work very hard to make sure that each of the teeth that I design are custom designed for our patients. People don't get the same smile that the person before got. They're customized to their face, to their skin tone, to the color of their eyes. Sometimes they bring photos of the past, or they bring photos of other people that they want me to look at.
Well, what if you have bad gums? Loose teeth, bleeding gums, all of those things. Not a good candidate for dental implants?
Actually, these are really good candidates. Periodontal problems are associated with the teeth and the bone, but it's not a problem of the bone in itself, it's a problem of the teeth causing the problem. Once the teeth are removed, which is one of the treatments for periodontal disease, the bone is healthy again.
So the gums get healthy?
The gums get healthy.
Okay, interesting. And how long can they last?
They can last for many, many years, like natural teeth.
So just as like your regular teeth?
Healthy, regular teeth. So this is another example of a patient. She used to be
a young person.
She's young. She used to be in the dental field, used to be a dental assistant, and unfortunately, she ended up developing periodontal disease. After many years of this disease in her mouth, the teeth started to move into different positions, and she didn't feel like she could carry on her life. She focused in raising a daughter, getting her into college, and at some point, the attention came back to her. She was engaged, she was going to get married, but she wanted to look different for this special occasion. So people like this, what she was experiencing, she could not eat the foods that she wanted to enjoy. The teeth were moving.
It hurts?
It hurts. She was biting into foods, and there was just a lot of pain. So this is not what she wanted. She wanted to change it.
Do you get excited on the consult sometimes?
Very excited.
Where you go, boy, this is going to be good?
Very exciting. Very exciting moment, because I can already start to see what the end result is going to be. I can already picture it. It's putting the final piece together when I'm talking to them.
Okay, let's take a look at her after.
So after we did her treatment,
very pretty.
4 implants in the upper jaw, 4 implants in the lower jaw. She has a beautiful smile. A couple months later, she got married.
Okay.
And I've seen her for post-ops during the last 3-4 years, and she's doing very well. She's still loving her smile. So Randy, I want you to look at the before and after side by side.
Okay.
Look at the after photograph. Look at how nicely the teeth will fill in her smile line. She can now have a much wider smile. Look at the before and look at the after in terms of her eyes. Look at how wide her eyes are now. She's excited. She knows that she
has a more youthful appearance, that's for sure.
Much more.
And almost like sophisticated.
Absolutely.
In a way.
Absolutely.
Makes a difference, I guess.
It's a big change.
I'm not trying to side with you, but it is a fact. I think anybody looking at this, that the smile made a big difference.
It's a huge difference. She deals with her life in a completely different fashion now.
Okay, you like this?
I love it.
Out of all areas of dentistry, in all your years, you told me on the phone. You said this is the best. Why?
You know, being able to have such an impact in somebody's life is a unique experience, and I get to do it every day.
Okay, good. Okay, we have time for another photo, and then we're going to take a quick break.
So this is another gentleman.
So it's a lot of men and women, kind of a mix?
Absolutely, absolutely. Men are also seeking this type of treatment alternative. This patient had a problem with his teeth because of the periodontal disease that he was living with for a long time. What this photo does not tell is that when I met him and I was doing his exam, that front tooth was completely out of his mouth. It was a loose tooth. He just kept it there for his appearance, because he'd rather have that tooth there than just have a space. And basically, he knew that he was facing 2 different treatment alternatives, dentures or implants. His lifestyle, what he enjoys in life, is riding his motorcycle. He knew he didn't want to be riding his motorcycle with a denture, because he's heard the stories of those people that are wearing dentures and are suddenly cruising down I-17, and they open their mouth, air comes in the mouth, and the denture flies out. He didn't want to do that. So we provided him the dental implant treatment. He has 4 implants in the upper jaw, 4 implants in the lower jaw, and now when he's riding his motorcycle and he smiles, the only thing he needs to worry about is bugs hitting his teeth.
So now he's got a full upper and lower teeth that don't come in and out. So they're fixed in there.
They're fixed there.
Okay.
Look at the before and afters. He's a more youthful looking individual.
That's right.
He can deal with life in a completely different way, and just
so he probably smiles more.
A lot more. Yeah, he smiles a lot more.
Now, I think you told me, you say that sometimes you have to, for these photos on the befores, you have to force them to smile, because they don't smile. Is that right?
It's one of the hardest parts of the consultation appointment. When I'm meeting with them and I want to design their smile, they don't understand why I want them to smile. I understand they don't want to smile at me, but it's difficult. They've guarded themselves. They're used to bringing their hands to their mouth so that they can cover the mouth and not expose the problem that they're dealing with.
I've had over 12 root canals, about 15 crowns. They started falling out at the gum line. That's when I decided to go to Clear Choice. They talked to me about implants. When I learned about how the one day works, I wanted to have the procedure done the next day. I was going to wake up and have a beautiful smile.
We're able to use our technology to help them to enjoy life without a denture, just with teeth that will be permanently in their mouths.
At Clear Choice, we're bringing hope to thousands here in the Valley of the Sun who suffer from missing or failing teeth.
The team is the entire center. You have myself, the prosthodontist, Dr. Galindo, and the lab. Everybody works as a team to get these folks not just a smile, but a new function, a new lease on life.
Call today for your free consultation. We'll walk you through the entire procedure, including costs.
To have the smile that I wanted back again was amazing. I would have done it a long time ago had I known about Clear Choice.
At Clear Choice, you're about to discover what you've been missing all these years. Call Clear Choice today.
I had cracked teeth, crowns. My teeth were really, really bad. I started hearing about dental implant surgery. When I researched and saw what Clear Choice could do, I thought, maybe this is for me.
At Clear Choice, we bring hope to millions who suffer from missing or failing teeth with dental implants that look, feel, and function like strong, natural teeth.
All the specialists with all the technology they need are in one spot. It makes delivering this 21st century world-class dentistry very easy to do, and we do it in one day.
They can do something permanent that's always there. You never take it out, and it gives you that solid foundation.
Call today for your free consultation. We'll walk you through the entire procedure, including costs.
When those folks gave me the mirror and I looked at myself, these tears just makes you feel good. Clear Choice did that for me.
At Clear Choice, you're about to discover what you've been missing all these years.
So when it's all done, and they start coming in, I mean, you see, do they almost take on a different personality sometimes?
It's like we treated somebody else.
Really?
Yeah, they're completely different. They're extroverts. They feel more comfortable about themselves. Perhaps they dress differently. It's somebody that's brand new.
Very nice.
This is a story of another patient,
okay,
a woman, that had been dealing with missing teeth for a long time. She has a partial denture, and a partial denture is designed with wire clasps, and if you have a high smile line like the one that she has, she's showing these clasps. Everybody knows that there's something happening with her teeth. So she is sharing some of her intimate life with everybody that she meets, because it's obvious, it's apparent.
Okay.
What we did for her was a similar type of treatment. Her teeth, because of the periodontal disease, because of the advanced decay that she had, could not be maintained. And the option that she chose, the option that she wanted, was teeth that would be permanent in her mouth.
Or like fixed in her mouth?
Fixed in her mouth.
Okay.
Correct. So we completed this treatment. Every single time, this is the post-op photo.
Okay.
Every single time.
Boy, look at that smile.
It's a huge smile. She's also become a very good hugger because she is so grateful about the change that she has in her life now that she wants to express her gratitude with everybody at the office.
So she could eat, obviously. I mean, we've talked about this, but they could eat whatever.
They can eat whatever.
Are they ever, I mean, what about like carrots?
Absolutely, carrots.
Or broccoli? Or
broccoli, apples, celery. All these things that these patients had stayed away from because mechanically it just doesn't work with a denture, these are things that they can enjoy again.
Okay, good. We have time for just maybe one or two more photos.
Very good. This is another male patient that we treated, and he had a similar situation in life with somebody that I described before. He enjoyed being in the outdoors.
He doesn't smile. Is that his smile?
That is his smile after I convinced him that he wasn't going to get any lunch if he wouldn't give me a smile.
So he looks like a tough guy, probably.
Very tough guy.
Okay.
He used to be a special ops individual, and very tough, but he had a weak side. And he just couldn't enjoy the outdoors the way he wanted to enjoy them. He couldn't go out on his motorcycle, on his ATV, because he was afraid that the bouncing around would loosen the denture and off it would go. He had told me that he had replaced his dentures 3 times because of riding accidents. He was on his motorcycle, air came in his mouth, the denture flew out, he turned around to look for it, either couldn't find it or had been driven over. So you can't live your life like that.
So now, so in one day,
after
the imaging, you get that out of the way, in one day, they walk out with a set of teeth.
Once we confirmed with the imaging that he had enough bone for the procedure, the day that we did the procedure, he left with a brand new set of teeth. He wanted to ride his motorcycle that day, but we didn't let him.
Let's take a look at this.
This is his final photograph. And he's very proud.
He doesn't look like the same guy. He looks very happy here.
He's a very happy guy and very proud about what he did in his life in the past.
You said they have to learn how to smile because they've gone so many years.
They do. They do. And it doesn't take that long. It's just a day or so of looking at themselves, understanding who they are again, and it comes back naturally.
Now, what if you've been wearing dentures, though, like 30 years, 35 years wearing a denture. Can you still do this? Because isn't it true
Absolutely.
you lose bone though? You don't have enough bone?
Yes, you lose bone. But having the CAT scan at our center allows us to look at these cases that otherwise would be rejected and offer them a solution that will help them.
We're out of time, but how old can you be to do this?
There's no age limit. There's really no age limit in this procedure. I've treated somebody that was 97 years old. A colleague of
97 with dental implants?
97.
Now, why would they want to do that?
Because it's the most important stage in life to get a proper nutrition. If you can't eat the healthy foods when you need them the most, you're going to have a hard time.
All right.
You need to be able to take your fiber. You need to be able to have the right veggies, the right fruits, the right protein. So there's no limit in this procedure.
Good stuff, good stuff. Now, somebody watching this, and we're out of time, maybe they're afraid. Of course, they're afraid of the dentist, right? Nobody likes going to the dentist. But they're in pain or they're wearing a loose-fitting denture. What do you say to them?
The easiest thing to do is schedule a consultation. At that consultation, we're going to learn what the problem that they have is. We're going to take a CAT scan. We're going to look at their bone and come up with a solution that will help them change their life forever.
Thank you for coming on. Great stuff.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.